Have you heard of a situation where someone did several lab tests, several scans, and everything, and was told that nothing is wrong with him or her? But to the contrary, the individual keeps telling you, I feel something is wrong with me. I feel I am sick. I feel I am unwell. I feel things are not all right. Do you know the name for that very condition? All right, all right, I know you want to know. Get the chair, come close, pick a glass of water. I'm going to tell you what that means. And if you want to hear it, why not click on that very thumbs up and then give me a thumbs up? Or if you're yet to subscribe, why not click that subscribe button below and turn on all notification bell so that whenever content like this drop, you'll be the first person to be notified. Having said that, what is the name for that condition where an individual keep doing several lab tests and keep doing several scans and other medical checkups, but he is told that he or she does not have any issue, anything wrong with him or her, but the individual deep inside that individual, he or she knows or keeps telling you that I feel something is not all right. The name for that condition is called hypochondriacal neurosis or hypochondriasis. So you want to ask me, what is hypochondriasis? All right, I will start by giving us the definition. So hypochondriasis, also known as illness anxiety disorder, is a mental health condition characterized by excessive and persistent worry about having a serious illness, despite medical tests and reassurance indicating no evidence of illness. It can also be defined as a mental health disorder characterized by excessive fear of or preoccupation with serious illness, despite medical testing and reassurance to the contrary. It was formerly called hypochondriacal neurosis, but currently called hypochondriasis. Having said this, what are those criteria for one to be diagnosed of having hypochondriasis or hypochondriacal neurosis? The first criteria, according to DSM-5, is that there is a preoccupation with having or acquiring a serious illness. Once there is that preoccupation, the individual keeps telling you that he has a serious illness, or he feels that he or she is going to have a serious illness. That is one pointer. It is not enough. The second one is that no or minimal somatic symptom. What we mean is that bodily there is no symptom or there is minimal symptom. This individual will keep telling you there's this symptom or the other. But in terms of bodily symptom, there is either no symptom or there is minimal symptom. The third criteria is that there is excessive anxiety about health. The individual is worried about coming down with a very serious illness. That is the third criteria. The fourth criteria is that there's repeated checks or tests for reassurance. There must be that track record of having done several testings just to reassure the individual or to see if they can confirm the presence of a particular illness. And then the final criteria to look out for is that there is persistent worry despite medical reassurance. So when these 5 conditions or pointers are available, then you can comfortably say that this individual has hypochondriasis. Let me take them again for emphasis. One is that there's preoccupation with or having a serious illness. 2 is that no or minimal somatic symptom is present. And 3 is that there's excessive anxiety about the health state of that individual. 4 is that there's repeated checks or tests done for reassurance of this individual. And 5 is that there's persistent worry despite medical reassurance. If these 5 criteria is present or are present in this individual, then you can comfortably say this is a case of hypochondriasis. Do you know how those individuals are called? I know you may never have heard about this. So let me tell you what they are called. They are called hypochondriacs. Yes, that's the name. Having heard this, that will take us to the symptoms to be on the lookout for hypochondrias. One is that there is excessive fear of serious illness. And the common fear of this individual is he or she is scared of coming down with cancer or HIV. That is the very common fears the individual has. The second one is that there's frequent self-examination and monitoring. The individual keep checking his or herself, check her body, check his or herself. Constantly, there is that checks. And then the third one is that there's repeated doctor's visit. He keep appointment, constantly book appointment to see a physician. That is the third symptom to pick out from an hypochondriac. And then the fourth one is that there's excessive research on illness. The individual constantly go to net, constantly goes online to check. This symptom I'm having, what conditions have this symptom? The worst of them is that when you mention any illness to that individual, you have done more harm than good. Because the individual will go online immediately to check what are the causes of this condition and what are the possible complications following this condition, and would term all the symptoms he has. Even when those symptoms are not present, he will magnify anything that looks similar to be the presence of that condition. And then the fifth one is that there's avoidance behavior in this individual. He avoids medical procedure. He keeps avoiding medical procedure to be done. And then the fifth one is that there's significant distress or impairment in this very individual. There's the significant distress. Now, let me tell us something you want to hear. In this individual, especially where they are looking for children, for instance, do you know that that individual, because is preoccupied, emotionally she becomes unstable, and then there is hormonal imbalance where there could be possibility for amenorrhea or absence of menses, and she would tell you that she has pregnancy. She has finally gotten pregnant. Interestingly, there can be those early CICs, what we simply mean those early symptoms of pregnancy. But do you know that there is something that will be missing? I know you want to hear. What will be missing is that from today till infinity, every pregnancy test run on that patient would show negative. Does this topic look interesting? If you are already finding it interesting at this point, why not click on that subscribe button if you are yet to subscribe? Let me know your opinion on this condition in the comment box, and then give this very video a thumbs up. So let's push further. What are those possible causes of or the risk factor associated with this very condition? The first one is that genetically, there could be genetic predisposition to this factor, especially where the parent or one person along the family trait or the family tree has had that very condition. 2, there's a past medical trauma, for instance, surgery and so on, could make the individual suspect every symptom. And then there's a family history of hypochondriasis, as I earlier said. There is also anxiety or depression. It could cause it could predispose to coming down with this condition. There's a stressful life event that is taking place in that individual life if you check critically. There is something that is stressing that individual life. There is something that is stressing that individual life within that very time frame. That's why I used someone seeking for the fruit of the womb or someone seeking for child. Do you get? And then hypochondriasis are not, the causes are not really known. Except for other things I've just said. The true single cause is not known as of now. And then adult hypochondriasis may sometimes reflect a self-centered character structure, which is somebody that wish to be taken care for. So you will call this person someone that is either narcissistic in nature or attention seeker. All right? Can make someone come down with this condition or predispose someone to this condition where attention is sufficient attention is not given to the person and he wants to get the attention. He could put up these symptoms. And then for the elderly, hypochondriasis may be associated with depression or grief. And then it may also involve biological basis such as hypersensitivity to stimuli. So every single sound that the body produces, that individual would magnify it. And that's why one of the symptoms to check out is that there might be physical symptoms, but the individual exaggerates it. That's why we say nil to minimal symptom present. But the condition that individual suspect is not present. Do we get? Having said that, maybe let me just give us further symptoms to add to the earlier ones. Is that most hypochondria are worried about being physically sick, although some expresses fear of insanity. Some of them express fear of being mentally unstable. And then the symptom may range from general description of specific illness to an unusual complaint. Also, to add to the signs and symptoms is that in many instances, the symptom reflects an intensified awareness of bodily function such as the heartbeat, breathing, and stomach noises or sound. I have already explained that. Then the symptoms are not delusional. Please, they are not delusional in any way. They are real, but the patient actually overemphasize it or misinterpret it. Do we get? So you can't misinterpret the body function to be as a result of a serious lethal cause. Having understood this, what are the possible features for these very hypochondriacs? So having understood this, we'll go to how to manage this very condition. First of all, from what we have said, you could be able to diagnose someone using the criteria and the signs and symptoms. Someone who has this condition. Diagnosis is the first step. And then after doing so, cognitive behavioral therapy has a major role to play. Cognitive behavioral therapy has a major role to play in hypochondriasis. Exposure and response prevention is necessary. So, what do we say in essence? We are saying that this individual is symptomatically managed. So with each symptom he or she is having, you manage the symptom. Okay? And that's why most hypochondriacs have a whole log of or bag of medications at their custody. Does this topic look interesting at this point? Alright, having said that, mindfulness-based stress reduction is necessary. Remember I said, don't tell that individual a particular condition because for each of the checks this individual goes for or each of the appointment he books with different clinicians, he or she will come down with different names of his or her condition. Having said this, Relaxation techniques are necessary just to handle the aspect of the anxiety. Medications such as antidepressants as well as anxiolytics or benzodiazepine are necessary because a couple of them becomes depressed, isolated, and anxious. They are preoccupied with the signs and symptoms of possible presence of an illness. What are the complications that then follows hypochondriasis? They include, but not limited to, social isolation because they feel people don't understand how they feel. Relationship problems comes up because when they tell you they have it, you say they don't have it. You have issue with them. Depression comes up because they are constantly afraid, especially where there is that symptom that looks maybe similar. And then anxiety disorder because they are constantly scared if this symptom is something very serious. And then they could have somatic symptoms disorder, somatic symptom disorder. So what does somatic symptom disorder mean? It means bodily symptoms that are actually exaggerated. So this individual exaggerate or misinterpret their symptom. Having said that, what are the prevalence of hypochondriasis? Hypochondriasis affects about 1.3% to 10.4% of the general population. Yes. Now, more common in women. You will commonly find hypochondriasis in women. Remember I talked about the case of those seeking for the fruit of the womb. And then it peaks in the midlife of individuals. Having said this, there are conditions that try to overlap with the symptoms of hypochondriasis. Some of them are the somatic symptom disorder we mentioned earlier, anxiety disorders, depression, factitious disorder, and then malingering. All these conditions will be discussed in separate videos. So if you want us to talk about them, let us know in the comment box. What are the assessment tools in diagnosing individuals with hypochondriasis? We have hypochondriasis questionnaires, which is called HQ. The second one is illness attitude scales, called IAS. And then the third one is health anxiety inventory, called HAI. Do you know there are interesting facts about hypochondriasis? The first one is that hypochondriasis is also known as health anxiety. The second is that the term hypochondriasis comes from a Greek word hypo, which means under, and chondros, which means cartilage. So it refers to the abdominal region. That's why most of the symptoms of hypochondriasis are around the abdominal region. Hypochondriasis can be a challenging condition to treat, as individuals may resist reassurance. That's the reason. No matter how you keep explaining, no matter what you tell them, they don't believe you. They believe there is something serious wrong with them. Having said this, would you like more information on hypochondriasis or related topics? Let me know in the comment box. If this very discussion or topic is something you have been hearing around you, or you actually find it interesting, or you want to learn more about it, let me know in the comment box. I look forward to that very moment when this channel becomes your most favorite click. For now, thank you and stay safe.